Are you feeling pain in your buttocks, in your glutes while walking or sitting for a long time? You're not able to bend because of your buttock pain? Then I have a solution for you. I have some exercise that is stretching and then some exercise which is strengthening. Buttock pain is usually either radiating or referred from the joint of your back or the muscle injury itself. Some muscles like gluteus medius or gluteus maximus can be injured with overuse. And this routine of exercise where you can combine strengthening and stretches, that works very well. So without any delay, let's dig into it. So first of all, we are going to talk about stretches. So let's check the piriformis stretch first. This muscle is very important. It's one of the rotator muscles that is rotating your hip and can injure with rotation exasperation. So how we are going to do this? This is called figure 4 stretch. So first of all, you're going to cross your knee and then put your hand behind the knee that is not crossed, and then you're going to pull it in and you're going to feel a stretch in the leg that is crossed. And then we're going to hold for a few seconds. Again, don't over stretch it, just feel the stretch and hold it. Then you're going to do 10 reps of this, and then we can alternate the side as well. If you do longer hold, you can do less repetition as well. This is the piriformis stretch. Sometimes sciatic nerve gets pinched between this muscle as well, and the tightness can cause sciatica symptoms as well. If you have sciatica related to disc, then you can check my video out here. Otherwise, we can move to the next stretch, which is gluteus muscle stretch. So this is in the similar area but more superficial muscle. What we are going to do is, here we're going to go on your back again and then use your both hand to clasp and then put it around your knee and pull your knee towards your opposite chest. Again, remember, it's not just pulling the knee, this is pulling the knee towards your opposite stretch, and you will feel very strong intense stretch in the gluteus area. This again can be done few second hold, but same time we can also do a good number of repetition. This is the 2 stretches. The third stretch we can do is hamstring and a calf stretch. This is also called sciatic nerve mobilization exercise. Again, you go on your back, use your both hand, clasp it behind your knee this time, and then you're going to straighten up the knee. You are going to feel stretch in your hamstring. Then pull the foot towards you and you will feel the stretch in the calf muscle. This is supine hamstring stretch, very intense. Again, you can do this mobilization 10 repetitions in maybe 10 second hold. If it is painful, sharp pain, you take it easy. Now we are going to move towards the strengthening part of these exercises. Strengthening part is very important because a lot of time if your muscles are weak and if you keep stretching, it's not going to work. Same way, if your muscles are tight and if you keep strengthening, it will not work. So if you need stretching, you need stretching. If you need strengthening, you need strengthening. So exercise number 1 for strengthening is clamshell. Again, this clamshell exercise is for the gluteus medius muscle strengthening, which is one of the external rotator of the hip. Now these clamshells can be done 10 reps to 15 reps in 3 sets if you can do it. So higher numbers of repetitions. How do you do is, you go on your side and bend your knee and the hip at 90 degree, and then make sure your hips and ankles are in the line. Here we're going to keep both the ankle in the same line but lift the knees up. So here you're opening up the knees like a clamshell. That's why it's called clamshell exercise. Very, very important, very isolated work. Here you're not using any other muscles, just one single muscle exercise. You will feel very tiring in the hip if it is done properly. Here we want to make sure we stay on the side and we don't rotate your back, because you will do the trick movement where you will rotate your back, and we want to avoid that. So you can also utilize the bands as well eventually. If you feel like stronger enough, then you can put the band around your knee and then you can do the clamshell exercise. This is very targeting this gluteus area if you have a buttock pain. Exercise number 2 for strengthening is hip abduction. Again, these are the hip abductor muscle, gluteus minimus, gluteus medius. Both are responsible for this motion. Again, these are the stabilizers. So when you're walking and you're getting a gluteus pain, it's probably from not stabilizing enough and they're getting tired or fatigued faster. So what we do is we go on your side, we keep the bottom leg bent so you're resting well, and then you can lift the top leg keeping it straight up to 45-degree angle. Not so high, you're not really flying high, but you're just doing this enough so you feel it in the muscles and then you don't feel it in the joint. Now if you have a joint issues like a hip joint issue, you don't want to do excessive movement. And you can do again this 10 reps of 3 sets every day. If you are working on this starts to stabilize better. Third exercise for the strengthening part is the prone hip extension. This is pure gluteus maximum exercise because this is the biggest muscle in the gluteus area, and if you have a strain or you're having issue with getting up or the stairs, maybe this is the right exercise for you too, but we need all of them as well. So first what you do is you go on your tummy and make sure we are resting enough, and then we are going to lift the leg that is affected straight up with keeping the knee straight, and we are going again 20-degree or 30-degree maximum, not really going too much backward because we don't have a lot of hip extension movement anyways. If you are doing too high, maybe you're doing from your lower back, which we don't need to do. This has to be done from your hip only. So this exercise again, same reps, 10 reps, 3 sets, and we can do this easily. Now exercise number 4, which is more complex movement but very important as well, because the previous exercises were only single muscle isolated exercises. This has to be done with the complex movement, engaging the core, back muscles, hamstrings and quadriceps as well as glutes. This is called gluteus reach. So what we do is we go on the back, bend your knees, and then make sure your both feet are shoulder width apart and good in the alignment. Here we are going to contract the gluteus muscle as well as the core muscles, and lift yourself up and make sure we create a good bridge where your knee, hip and the shoulder is in the straight line. And this exercise is very important for the overall body work. If you are not able to do other core exercise, this can be your core exercise as well. Again, we can do this more numbers if you are able to do it. For example, 15 to 20 reps with 3 sets. If you can't do that, then you can do 10 reps, 3 sets like our standard numbers. These are the exercises, and if you feel your gluteus pain is getting better with this exercise, then it is definitely your gluteus muscle problem. If it is not getting better, maybe there is something else going on, whether it is discogenic or it is coming from the other areas like SI joints. You can check these videos out whether it is a discogenic pain, and then you do this exercise. If it is SI joint issue, then you target these exercises and you can get better. If you like this content, please like, subscribe and share. Thank you for watching.